Since the opioid epidemic was announced in 2016, 11,000 people have lost their lives from the toxic drug supply that has devastated communities across BC.
BC has experienced an average of 6 deaths every day of every week for 2 years due to toxic drugs, and these deaths were preventable.
LaPointe says men between 30 to 59 years old made up 70% of those deaths.
Provincially, from November 2021 to October 22, deaths due to drug toxicity came second only to cancers in terms of potential years of life lost in our province. And the average age of someone dying from drug toxicity was 44 years old. These are population characteristics, but we all know, of course, that these numbers represent people who were loved, who were valued, and who are now greatly missed. Some had been experiencing problematic substance use for a number of years. Others used substances occasionally. Some sought opioids. Others believed they had purchased stimulants and died unaware that what they purchased on the illicit market contained fentanyl.
And one of those victims was sports journalist Jason Botchford, who accidentally overdosed at the age of 48 years old in 2019, leaving behind his wife Catherine to raise their 3 young children alone.
His secret became my secret, which became this harboring shame that I carried for a year. I was so fearful that people would judge him and tear down his legacy. I was fearful that people would judge me for not knowing. And even worse, I feared people would treat my children's loss of their father as insignificant because of how he died.
Dr. Nell Wyman is the acting Chief Medical Health Officer for the First Nations Health Authority.
First Nations people continued to be overrepresented in the harms and fatal consequences of toxic drug poisonings. Although First Nations people represent only 3.2% of the provincial population, they accounted for just over 15% of all toxic drug deaths in the province in both 2021 and the first half of 2022. First Nations people are dying at over 5 times the rate of other BC residents. Also in the First Nations data, First Nations women are disproportionately impacted. During the first half of 2022, First Nations women died at 8.8 times the rate of other BC female residents.
BC Premier David Eby says his government is prepared to do whatever they can to stop the crisis. He just decriminalized possession of small amounts of heavy drugs.
All parties focus on an evidence-based approach around drug policy because when you talk to parents who have lost a kid who thought they were taking some kind of a party drug at an event and ended up taking fentanyl and dying, you understand how serious this issue is and how it crosses partisan lines and how we all need to work on solutions.
For Catherine Botchford, who has been left to pick up the pieces after her loss, says that eliminating the stigma is crucial.
We all have a responsibility to change the narrative on substance use and the stigma associated with it. I stand here today to tell my story with hopes it will give courage to others to start their conversation about addiction and substance use, and perhaps through those conversations it will lead to a healthier alternative.
Tina House, APTN National News, Vancouver.